Piña, your Chief Inspirational Officer. I'm just streaming directly from this beautiful sun place in Story Creek of Florida. I just did my 5 a.m. Savers and Wellness Club. I also went about and did my gym today, and I am with my beautiful team of people who it's the team that I have done for the last almost a year, and we've been working diligently to bring the CURA100 initiative and organizations. We have 51 organizations, 5 podcasts now. We have a research group. We have clinicians, 2,317 professionals in network from Santo Domingo, where we have 15 psychologists, psychiatrists, psychoanalysts. We have the School of Psychoanalysis there. We have the Meta Poetry International Movement in Madrid. We have the Academy in Europe. And in the United States, we have practice in Florida, Las Vegas, Nevada, New York, the major states. And also we're going to go to 33 states. We have a wonderful team that it's compounded by Evelyn Fonseca. She is my administrative assistant, coordinator of billing and scheduling. We also have the Maria Usum, who she is in, Evelyn is in Chicago, and Maria Usum is in Turkey, and she's coming to New York. And I also have our newest intern to be, we don't know, Alison Pozo Cervantes from Kissimmee also, but from Ecuador. And we have Dr. Gloria Jean Baptist Precious, and she is in Brooklyn. And from Dominican Republic, Stephanie Adams, she is the public relations and marketing of our team. And today presentations, it's gonna be Kevin Purohit, and he's gonna present about AI and mental health disorders and mental health. He is a doctor from India, and Kevin Fonseca will present him formally, and he gonna give us a wonderful research. He's in charge of AI and mental health. He's our intern from the Global Populations Management Forum of Dr. Hameed. And here from the beautiful place of Kissimmee, I want to introduce you, Evelyn Fonseca. Evelyn, please present Dr. Kevin Purohit.
Hello, everyone. So I'm going to begin reading his bio here. So Kevin Purohit is a recent med graduate from India working as a coordinator for the Global Population Healthcare Management Forum, which is a multi-stakeholder organization reimagining the whole healthcare system under the global leadership of Dr. Rizwan Hameed in Brooklyn, New York. He is advancing the organization's mission for accessible, affordable healthcare globally, and he focuses on empathetic care. Also, he is a research assistant for CURA100 Global Research Group, where he contributes to the integration of behavioral health into the primary healthcare office under Dr. Jorge Piña. With experience in holistic care, teamwork, and patient-centered approaches, he prioritizes human care. Without further ado, I'm going to pass it along to Dr. Kevin Purohit now.
Woo!
Thank you. Thank you,
From
Evelyn,
India. Okay, let's go.
Thank you. Thank you, Dr. Pina, for the wonderful introduction, and thank you, Evelyn, for introducing me. So let's begin our presentation, where I'm going to present that how artificial intelligence is for the mental health and mental health illnesses. So let's start. I will share my screen with you guys, and we can start my broadcasting.
Does he has the power? Does he has the power? Do you have the power, Kevin?
Yes.
Okay.
Is my screen visible to you?
Let me see. Yes, the screen is visible. Yep, we have it.
Okay. Yeah. Okay. So let's begin. So how artificial intelligence is for mental health and mental illnesses. I have created an overview of all the literature reviews that were available with the help of PubMed index journals and PubMed database and Embase database and Scopus. So it's an integrated research work which I will be presenting today. So let's start with the introduction that how transforming mental health care with the help of artificial intelligence in early diagnosis, detection, and treatment. Introduction. Improve diagnosis and understanding of mental health illnesses. Develop better pre-diagnosis screening tools and risk models. We are not looking for the improvement of mental health outcomes just, but we are also making an impact while making a better pre-diagnosis that this patient is more prone for developing depression or schizophrenia or ADHD. So we are developing better pre-diagnostic screening tools. Then we are enabling personalized mental health care, then analyze complex high dimensional data. Next, machine learning in mental health care. So in our triple M, eMMM, we are working with the help of artificial intelligence interventions and with the help of gene ancestry, life biomarkers, and many other revolutionary things. We are creating the mental map. And with reference to our project, I am presenting this presentation, which is about machine learning. Machine learning is an AI approach that involves training algorithms to learn from data, that how the data which is already published can help us and how we can use the knowledge which is already published over the internet with the help of machine learning tools, how we can diagnose different conditions, especially of mental health. So, what are the different types of machine learning? So, supervised machine learning (SML), which uses labeled data to train algorithms to predict outcomes. Then there is unsupervised machine learning, which uses unlabeled data to discover underlying patterns and relationships. Then there is deep learning, which uses artificial neural networks to analyze complex raw data. The example of deep learning can be deep neural networks, random forest. For example, deep neural network is very accurate in diagnosing depression. Random forest is very accurate and precise in diagnosing ADHD and schizophrenia. So those are the different subtypes of deep learning machine learning tools. Then another one is natural language processing. NLP is a subfield of AI that involves using algorithms to process and analyze human language in the form of unstructured text and involves language translation, semantic understanding, and information extraction. Machine learning methods identify patterns in data to predict outcomes at the individual patient level, whereas which we are using as of now, whereas traditional statistical approaches focuses on making inferences about population. So this was about machine learning and traditional methods. But what the main discussion from this presentation is about the ethical considerations and difficulties which we might be facing with the advent of artificial intelligence in mental health. So, what are the ethical considerations for AI in mental health care? To ensure responsible AI deployment in mental health care, consider the following: algorithmic accuracy. Avoid increased risk to patients due to inaccurate predictions or diagnosis. Bias awareness. Recognize and address biased data such as subjective clinical text, data link, or linking mental illnesses to certain ethnicities. For example, we might be aware of the fact that there is so much of health disparities amongst populations. So there will be bias, and we need to address those kind of bias. For example, there will be selection bias, there will be stratification bias, there will be many different biases, and we need to recognize those and make some kind of efforts to reduce the health disparities which will be faced by biases. Which what is another one? Then another one is ethical principles, which prioritizes autonomy, beneficence, and justice, and augment these principles as needed. Then the next one is data and technology literacy. That there are so many knowledge gaps in this field that we need to address gaps in literacy for both patients and clinicians. Last one is establish standards. We develop and implement standards for AI use in healthcare settings. So those are all of the ethical considerations for AI in mental health care. And what are the different challenges and concerns we might be facing while using artificial intelligence? That is insufficient data. It's not very much research. So basically, we will be having knowledge issues and data issues with our model. So there will be some kind of insufficient data that computational scientists may use incomplete data sets, leading to inaccurate assessments. Bigger the bigger the study model, lesser is the chance for any sort of biases or any sort of errors. So, and there will be very much precision. So that's what we are up to. But we are working on the model which is very much accurate. So we need to address those kind of challenges and concerns with our model. Second one is clinician confidence. Clinicians may struggle to manage granular data or trust AI generated decisions. Like we need to believe on the work of ourselves. For example, like if I don't trust the judgment which is provided by machine learning tool or while using eMMM project, then it's of no use that how a clinician would trust his model would eventually make believe his patient that this is the future and this is how we are revolutionizing the healthcare through this kind of model. So that's very important. Then third one is institutional review boards. That limited knowledge of emerging technologies can lead to inconsistent risk assessments. So there will be this is another kind of issue. Then public awareness. Communicate AI capabilities and limitations to the public, ensuring transparency and contextual understanding. So we need to make our public aware that this is the future model which we are creating and how we can implement for the better diagnosis and accuracy of mental health conditions. So this is one of the concern which is through the AI intervention in mental health care. But how we can direct uh, and how we can progress while facing those kind of challenges. So we can integrate ethics into AI development, prioritize research, education, and resource allocation. Collaborative approach foster communication and cooperation among experts, including scientists, clinicians, regulators, and patients, basically building a multidisciplinary team. So we need to coordinate amongst different teams. We need some kind of relevancy that this is through the communication or this is through the scientist research or clinician model. So that is how we can direct our patients for using our AI-based intervention, and that is how they will put their trust in ourselves. So that is also very important. And human AI collaboration. Combine human intelligence with AI to ensure construct validity, appreciate unobserved factors, and mitigate potential mistakes. So we might be aware of the fact that AI would not replace humans, but it would definitely replace the humans who are not equipped of using AI in their practices. So that is very futuristic direction, that there will be a need for collaboration of human and AI. So that was all about today's presentation of how AI can be intervened with mental health, and how we can revolutionize the field of mental health. So thank you everyone, and
Dr.
I will
Kevin Purohit, thank you. Thank you very
thank
much.
you very much.
I love it. It's part of the impact that India, as a representative of the eMMM, is doing for CURA100 AI Global. We love the presentations. We're gonna have a couple of discussions now, comments and questions about your
Sure.
presentations, and also let me let you know that we have the team from Chicago. Emily Fonseca is with us. Also from Turkey, we have representing Turkey, Mari Usum. Remember that Dr. Bahadir also is from Turkey. He's a neurosurgeon
Yes.
doing a PhD in the United States. Alison Pozo Cervantes finishes her master in clinical psychology. She's a psychologist from Ecuador. Dr. Gloria Jean Baptist, she is in Brooklyn. People from Brooklyn. Woo! Oh, but also Rosara Ray from Brooklyn. And from DR, Stephanie Adon. We have processing for a process of grieving what happened in the collapse of the Jet Set Club where Ruby Perez was singing. It's something that is like still in our heart. It happened on Tuesday, and we're still crying about it. So remember, if you have a situation right now, suffering, you can call Dr. Piña 347-884-3544. No payment attached, for free. We have a team in Dominican Republic. We have 15 psychologists. We have a team completely. You can call Stephanie Adon, my assistant, to help you out. Anything that you need, you can do it right now. So remember that, globally, 347-884-3544. And I will take the call myself. I will bring it to my psychologist in the art, psychoanalyst and psychotherapist, just to help. So thank you very much for Kevin Purohit. So now you have you have prepared 4 presentations for the team eMMM, and you are an amazing also presenter. Uh, Give us the difference between the first presentation and this one, and why this one is interested for the eMMM project.
Okay. Thank you for asking, Dr. Pina. So the first presentation which I presented the previous Friday was all about the machine learning tools, its integration with the AI, and how we can help for diagnosing different mental health conditions. And this presentation, which was reflecting the use of AI in mental health. So today's presentation was on a very broader aspect, that how artificial intelligence can revolutionize the mental health. And the previous one was about the machine learning tools, which I discussed, that how it can impact specific conditions like depression, schizophrenia, ADHD, personality disorders. So that was all about specificity, and this was all about generalized information in mental health.
Good. All right. So uh, Bill Gates said that probably in less than 5-10 years, we people, clinicians, gonna be working 2 or 3 days because AI most likely will be taking care of businesses. All right.
Yes.
So, what can you say about the confidence that is needed for the clinicians to understand, use, and apply the AI model as we do? My team is doing that. We're using AI all over the place. And eMMM is going to be a completely platform for AI, mental health processes, diagnosis, protocol, treatment, follow up. How is important the confidence of the clinicians, doctor?
Sure, doctor. I would address that. AI is the new future of clinicians. I have already mentioned that AI would not replace the clinicians, but it would replace the clinicians who are into the dinosaur era, who are not equipped for using AI. So that's the main concern, that we need to be equipped with AI. We need to develop some kind of confidence into the machine algorithms, which the big brains of the world has developed. So we need to put trust in them, and we need to make a judgment call that how we can make an impact which is very much versatile throughout the world with the advent of AI in healthcare. And that's a very futuristic model, which you already told that it would be coming in upcoming 5 years. So it's very true that I think it is the future of healthcare, that how we can integrate artificial intelligence and how we can make our patients a better person. We are not just treating any sort of disease or infirmity, but how we can revolutionize their health by the advent of AI. So that is what I wanted to share with you, Dr. Pina. Thank you.
Perfect. So before I go to the clinicians today, my psychotherapist, Cara Marie Zoom and Rosara Van Rail, and then I will go to the interns and also the clinician Evelyn Mateo. I will give you a couple of seconds to give a comment or have an introduction. But remember, CURA100 Global, it's a super group of clinicians based on the United States, licensed in New York, Florida, and Las Vegas. We have several not-for-profits in New York City, Florida, Madrid now, and in Santo Domingo. We have the newest foundation with 15 psychologists as we speak, and a couple of psychiatrists working completely to help humanity from the Caribbean. I got my registrations as a medical doctor last Friday as a psychologist, so that's wonderful. So I can do a lot of things together. We also have those three non-for-profits. One, the International Meta Poetry in New York, Florida, the European Academy of Meta Poetry in Madrid, and the Dominican Foundation of Psychoanalysis and Meta Poetry to train a society to hold psychoanalysis as dynamic in Santo Domingo. So remember that. We have 2,317 more. The last time we counted, it was 2,317 clinicians, coaches, psychotherapists, psychiatrists, doctors, social workers, family therapists working as a team. It's important for us to give a robust response to humanity in terms of mental health. That's what we do. That's why I am waking up at 5 a.m. every day, Monday to Sunday. People telling me, Dr. Piña, how you do that? How you do so many things? I have a wonderful team. And by the way, I wake up at 5 a.m. in the morning. So, I mean, like, in the last 300, let me tell you the numbers. I'm waking up from the last 326 days, 5 a.m. Now we have 12, 13 miracle mornings person that wake up with me, and then we discuss the 7 habits of highly effective people. We meditate, we do exercise, blah, 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 blah. We do a lot of things in the morning. So that's the CURA100 AI Global, and this is your podcast. This is number 7. So, Marisun, what is your take from Dr. Kevin Purohit's presentation? Then I'm going to go to Rosario Manriel.
Thank you, Dr. Pina. Dr. Purohit, I really enjoyed your presentation, and it really gave me a lot to think about AI and how I'm using it day to day and what I need to do to actually strengthen my skills in this profession, using AI. But I wonder, based on what you've shared with us, what developments in deep learning do you see as the most promising for improving mental health care in the next 5 to 10 years?
It's increasing on a massive scale. Thank you for asking. I think what we have achieved in the past year, that we have developed different machine learning tools like random forest, deep neural networks. First of all, there were no any sort of advent in machine learning. It's developing on a massive scale. So it won't take about 5 to 10 years as of now. It might just take a year or two from where we are as of now. So that will be a very revolutionary step in the field of medicine, that how machine learning tools are helping for the pre-diagnosis, how they are treating the patients, how they are communicating the patients. They will be the human model. They will interact as how we guys are interacting with each other, and they will counsel the patients. They might provide cognitive behavioral therapy as of now. They will provide motivations to patients. They will cure their depressions. So this is kind of the futuristic approach we are up to, and it's not very much far from today. Thank you.
All
Thank
right.
you.
Perfect. Thank you. Very good response. Rosario Banrail from Panama, USA. All right, Rosaura.
Yeah, hi everyone.
Is
Hi.
Panama? Or is
Yeah,
okay,
Panama.
good. Panama.
Yeah. So again, very informative presentation. One of the things that captured my attention, and is because it basically like painting a picture of who I am. It says AI will only replace those clinicians that remain in the age of the dinosaurs. So this data suggests, and that sort of like paint a picture of who I am. So this data suggests that it's important to learn about AI, especially in the healthcare applications. So what will be a good way to learn the basic of AI or machine learning in relationship to the healthcare applications?
Oh, that's a great question, Rosario. Thank you for asking. So we need to take one step at a time. That AI is so vast that we can't capture the whole details in just a single sitting or a single meeting. But we need to start from just basics, like what is AI, how it may help us, how it will help the patients. So we can, you might be familiar that there is chat GPT to help and assess that what we are up to, that can answer our silly questions also, that can chat with us. So those are different kind of models which is already into the market and into the IT sector, but we are integrating the AI, artificial intelligence, into the healthcare. The healthcare is very much sensitive as compared, because we are directly dealing with the humans. We are dealing with the emotions of human beings. So it is very much important to integrate and learn and to evolve with the current system, that how we, for example, we have evolved and started using computers. We have created and stored our data in Excel or Power. We are making PowerPoint slides and making presentations of our Zoom meetings and sharing our podcasts on YouTube videos. So that kind of basic evolution we will be needing into the future, that how we can use the basic AI models and how we can make a change and impact into the lives of patients and our close ones. So we need to make a change and evolve our systems and evolve ourselves also, that how AI can be helpful. We are aware of the fact that AI is helpful, and we will be integrating AI in our daily routine. So that's the motto, that we need to evolve our um and expand our horizons and basically integrate AI into our lifestyle. So I hope I answer your question.
All right.
Oh, Yeah, sure. Certainly, Kevin, you answer it. As a matter of fact, I wrote down a few of your words so that it can continue resonating in my brain. It said we have to integrate, learn, and evolve. And I will
Okay.
remember those words them and try to practice more the use of AI in my
Sure.
everyday activities. Thank you, Kevin.
Perfect. We have 2 minutes. We're gonna give Gloria Jean Baptist. Gloria has been working on the recommendations of digital treatment. The next topic is gonna be about the FDA approved digital treatment assessment, diagnosis. Also, Evelyn Fonseca has been working on the AI coaching and human coaching. Now we're gonna be working on the applications and uses of them with example of platform that are using the AI coaching versus human coaching or the hybrid technology. Dr. Gloria Jean Baptist, what is your take?
Yes, I first will say it was a very insightful presentation, very relevant, and coming from it, I emphasized in my head what next by looking at some of the highlights in the use of AI in regard to mental health. And what I found was that he did a very good job in citing areas that should be priorities right now, such as the biases that health biases found in AI, the algorithms, subjectivity. That's big. Data and technology literacy. Um, there's a need for more research, and as a result, for us to make informed and relevant decisions, we should be digging deep into informing our medical practitioners at all levels how to become on board, as Rosura said, data literacy. So it's so relevant. I saw that he also mentioned that we need more comprehensive data, and I do believe quite so. Also, the question of trust, that is so key to selling the whole concept of AI to our patients. If, as a clinician, I cannot demonstrate that I trust this tool, this device that I'm using, how could I convince my patient? It couldn't happen. So we have to look at how we can generate trust, how we can improve our trust, and how we can convince our patients to be receptive to the idea of care and treatment from us. Also, with limited knowledge, which he mentioned, we will be inconsistent with our diagnosis and treatment. Again, he is sending us back to being aware, be informative, and let our research guide our practice. Last, he prioritized the need for fostering community. All stakeholders need to come on board. We need to establish a common platform. It does not matter where we are located, which country, what our experience is, but we need to find a way to generate a global platform in discussing how best we can move forward with a plan to implement AI in regards to care and treatment. Thank you.
That's the best way to finish the podcast, Purohits. That's the final words. Beautiful word from Dr. Gloria Jean Baptist from the United States in Brooklyn. Thank you very much, everybody. Kevin Purohit for your presentations. Alison Pozo Cervantes, Cara Maria Usum from Turkey, Evelyn Fonseca from Chicago. We also have Stephanie from the Dominican Republic, Rosaura from USA, Panama, Evelyn Mateo was moving. I'm sorry that I get you out of the video, and she's in Yonkers. And next time, what is your next topic, Dr. Kevin Purohit?
I will be referring to the how different machine learning tools has already make an impact in diagnosing mental health conditions. So I will share the data and I will reflect different machine learning tools that how it has made an impact in our in improving mental health outcomes. So that's the next
Perfect.
topic, doctor.
Thank you
I
very
will
much.
deep dive into specificity.
Thank you. I will send you, as always, send you the introductions. So we have the bio with the introductions. We put it together to the YouTube presentation. I will send it right away so that we can share it globally to everybody, so everybody can like it. And this is an impact to the world. This is a contribution from us and from India and the CURA100 AI Global Supergroup. Kevin Purohit, again, thank you very much. And see you next week in the eMMM Mind Meta Mapping Project. Bye-bye. Adios.
Thank you, everyone. Bye bye.
Gracias. I'll be